When you are conducting screenings for adverse childhood experiences, really try to think about them at various levels. So you have individual relationship level factors. So you have things such as the parent's age, the socioeconomic status of the family, whether there are a large number of children in the family. You have relational variables to consider. So what is that parent-child relationship like? You also have community and societal factors. So are there things at the community level, for example, social support? Is there a lot of social support in the family? Are there policies in place in schools, for example, that might be impacting how a child is progressing in treatment, or that might impact how a child can progress in treatment? So making sure that as you're conducting your assessments that you're also assessing the myriad of things that can affect the child and his or her family.
When I'm conducting screenings with families and looking for particular risks and protective factors, some of the things that pop out for me are looking at families that might be isolated. Not having an active or available social support network is a pretty big risk factor for being able to early identify instances of adverse childhood experiences. Particular cultures are at higher risk for this type of scenario or circumstance, such as immigrant families. Immigrant families whose primary social support may be across the waters. And so when I'm conducting intakes and find out that a family is isolated in that way, that's something that I'm going to want to address as we move forward. Another risk factor is, again, previous experiences with adverse childhood experiences. So parents who report intergenerational abuse, parents who report intergenerational substance use, or unaddressed mental illness is a risk factor.
As a mental health provider, you may be called upon to address trauma and other symptoms resulting from exposure to ACEs. This work may include screening children for exposure to ACEs and related risk factors. You may also need to assess parents and caregivers for exposure to ACEs and related symptoms so they can receive appropriate care and, ultimately, reduce the chance that their children will experience ACEs.
Taking a dual generational approach to screening for risk and protective factors, for me, means just having interviews with both the parent and the child, sometimes separately. In the intake process, having an interview with a parent where they feel comfortable discussing the experiences that they've had in their childhood is important in letting them know that their experience is just as valuable as the one that their child is experiencing. For many families, when they bring a child to treatment, they are under the assumption that you as the provider are here to treat their child and not to treat them. And so it's important in those initial visits to communicate the understanding that their child's behavior and their child's symptoms or their child's experiences are a direct reflection of the things that happen not just currently in the home, but perhaps the modeling that has been occurring in the home as a result of experiences that the parent has had. It's important to decrease a parent's defensiveness around disclosing their own childhood experiences by inviting them to have a conversation about those things and encouraging them to seek help for the things that haven't been addressed.
Screening tools and techniques should be evidence-based and acceptable to the population with whom they'll be used. Visit the resources section of this training for more information and links to validated assessment tools that you can use with individuals, groups, and communities. Depending on the background and cultural experiences of the children, families, and communities you're working with, remember that some tools and techniques will require adaptation. While screening for risk factors can provide valuable information, mental health providers should also work to identify protective factors that can be enhanced or developed. Take a moment to review factors that can protect against ACEs.